Hello, this is Dr. Andy Higgins. This video segment is to try to address the frequently asked question of what is an estrogen receptor or hormone receptor positive breast cancer. So most breast cells have estrogen and progesterone receptors on them. I'm going to talk mostly about estrogen receptors as that is the more important of the two. We also call these hormone receptors. Well, those normal breast cells that have the estrogen receptors, active estrogen lands on those receptors that stimulate the cell to stay healthy and viable, as well as stimulate the cell to divide and make two new normal breast cells. Many breast cancers, the vast majority, are actually hormone-sensitive breast cancer. They express these estrogen receptors and progesterone receptors. So those same active estrogens in the system can land on the breast cancer cell estrogen receptor and stimulate that breast cancer cell to stay viable, as well as stimulating it to divide and make two new cancer cells. Where does active estrogen come from? Active estrogen primarily comes from, in a premenopausal woman, from their ovaries. Ovaries are corporate estrogen. They pour out active estrogen in a cyclical fashion through the course of the month. Thus we get those menstrual cycles that happen that are all related to estrogen surges in the system. That active estrogen then can stimulate those breast cancer cells. Active estrogen can also come in the form of hormone replacement therapy. That's either with synthetic hormones or even bioidentical hormones. Now, we know that synthetic and bioidentical hormones do not cause breast cancer, but they can stimulate a breast cancer cell if it has started and stimulating it to grow and to make more cells. Does a postmenopausal woman have to worry about estrogen receptor positive cancer? Well, yes, they do. Even in the postmenopausal time frame, women still produce estrogen. It comes from what I'll call the mom and pop shop. This is the adrenal glands making androgens, a precursor, inactive estrogen, if you will. And then that inactive estrogen is converted to an active estrogen in the system with an enzyme called aromatase. That primarily happens in fat cells, and that estrogen is also stored in fat cells. And so it's that activated estrogen after aromatization happens. That's where postmenopausal women get their estrogen. Now you have to remember, premenopausal, you have estrogen receptors way up here. Postmenopausal, you have them quite a bit lower. Corporate estrogen, mom and pop shop estrogen. Well, thank you for your attention. I hope you found this video helpful.